I'm Dr. Sayyeda Hafsa Fatima from Osmania Medical College, and today I am presenting a study on evaluation of different diagnostic techniques in the detection of Trichomonas vaginalis infection among women attending tertiary care hospital. Trichomonas vaginalis is an anaerobic protozoan parasite that inhabits the vagina in female, the prostate and seminal vesicles in male, and the urethra in both sex. It exists only in trophozoite stage, which is the infective form of the parasite. It causes trichomonasis, a sexually transmitted disease. An estimated 200 million women suffer from trichomonasis every year worldwide. Prevalence of trichomonas varies between 5% in patients at hospital and 75% in sex workers. The clinical infection in women can range from asymptomatic state to inflammatory state associated with vulvovaginitis and urethritis. It is associated with pelvic inflammatory disease, premature birth, low birth weight babies, infertility in both men and women. As the clinical features are similar to other sexually transmitted infections, they cannot be relied for diagnosis. Therefore, demonstration of parasite is required for accurate diagnosis of infection. The conventional laboratory method for diagnosis of Trichomonas vaginalis infection include direct microscopic examination of the wet mount preparation, staining, culture, molecular methods, culture being the gold standard. Aim of the present study is to compare various diagnostic tests for detection of Trichomonas vaginalis infection among women attending tertiary care hospital. The objective of the study is to determine the prevalence of Trichomonas vaginalis infection, to study the advantage and limitation of commonly available methods for diagnosis of Trichomonas vaginalis, and to compare sensitivity and specificity of the different diagnostic methods. Inclusion criteria: females between age group 6 to 60 years who complain of foul-smelling vaginal discharge, pruritus, pain in lower abdomen, pain in participant giving consent. Exclusion criteria: participants not giving consent, pregnant and menstruating females at the time of examination, women who were recently dosed or used spermicidal agent within 72 hours prior to testing. Study design: it's a cross-sectional study done between May 2021 to July 2021 with sample size 50. Material and methods: a total of 50 vaginal discharge samples were collected from patients attending gynecology OPD with complaints of vaginal discharge, pain, abdomen, pruritus. Vaginal discharge was collected using sterile pipettes in a sterile container. All the samples were processed as follows. Wet mount examination was done and observed under 10x and 40x to identify the size, shape, and motility of Trichomonas vaginalis. Giemsa staining, acridine and orange staining was done. Samples were inoculated on Kofferberg media and incubated at 37 degrees Celsius for 7 days. Coming to the results, a total of 50 female patients of reproductive age group were included in the study. The mean age of the patient was 32.32 years. Vaginal discharge samples collected from the patients were subjected to wet mount examination, Giemsa stain, acridine orange stain, and culture. The number of females positive by wet mount were 2, Giemsa stain 2, acridine orange 4, and culture 3. Comparison of the various diagnostic tests for detection of Trichomonas vaginalis infection, taking culture as a gold standard. Wet mount and Giemsa stain had a sensitivity of 66.6% and specificity of 99.5%. Acridine orange having a sensitivity of 99.5% and specificity of 97.9%. This is the image showing wet mount. This is the image of wet mount showing trophozoites of Trichomonas vaginalis. Giemsa stain showing Trichomonas vaginalis, and acridine orange stain showing brick red color of Trichomonas vaginalis. Coming to the discussion, according to WHO, Trichomonas vaginalis accounts for approximately half of all the curable sexually transmitted disease worldwide. There are many techniques to diagnose Trichomonas vaginalis infection. In the present study, wet mount examination, Giemsa stain, acridine orange stain, and culture were compared in terms of diagnostic yield, cost of performing the test, and turnaround time for the results to be produced. Out of 50 patients tested, 2 were positive for Trichomonas vaginalis on wet mount examination and Giemsa stain, having a sensitivity of 66.6% and specificity of 99.5%. According to the study done by Vesey et al., the wet mount microscopy is considered a highly specific diagnostic tool, having a specificity of 99.8%. However, the sensitivity is low, correlating with the present study. Though wet mount is an inexpensive and provides immediate results, it's a subjective test and requires clinical experience and access to microscope. Even in the hand of trained observer, wet mount is only 36 to 75% sensitive compared to culture. Sluggish motility and low number of trichomonas can easily be missed. Acridine orange staining detected 4 positive cases with 99.5% sensitivity and 97% specificity, which correlated with the other study done by Iamm et al. The staining method is easy to perform and screening takes less time. Its major disadvantage is that it requires special microscopic facility and trained personnel. Also, permanent record is not possible because of loss of fluorescence with passage of time. Culture is the most accurate method with high sensitivity and is considered gold standard for diagnosis of Trichomonas vaginalis infection. It takes 2 to 7 days to give a positive result. Comparison between various studies. In a study conducted by Khatun et al., wet mount detected 5.4% cases, acrid orange 6.3 and culture 8.1. Muthuswamy et al. Detected 5.3% cases on wet mount, acrid orange 5.3 and culture 6.1, which correlated with the present study. In a study conducted by Iamm et al., wet mount detected 7% cases, Jimsasian 5%, acrid orange 8% and culture 10, which correlated with the present study. Coming to the